Welcome to Coronavirus The Rundown. I'm Chris Stewart. This show lays out how America is responding to coronavirus. We start with a breakdown of the headlines, and today, a new batch of job numbers. 4.4 million Americans filed for unemployment last week, bringing the total number to more than 26 million since coronavirus started. Experts say the actual numbers are likely higher than that. Specific underlying conditions are common in severe coronavirus cases. A new study found the sickest patients often had high blood pressure, obesity, or diabetes. A separate study found 94% of New Yorkers who were hospitalized with the virus had at least one underlying condition. New cases of coronavirus in cats. 4 more tigers and 3 lions tested positive at the Bronx Zoo. And for the first time, 2 separate pet cats in New York State tested positive. Both had a mild cough and both are expected to fully recover. One cat's owner had coronavirus before the cat showed symptoms. The other cat had no known exposure. The CDC and the USDA want to stress this. There is no proof animals spread the virus, and there's no reason to take any action against pets that could compromise their welfare. And we mentioned the record unemployment levels. We're learning many people who file for unemployment haven't seen any money. Alicia Nieves is asking why.
Since coronavirus began forcing shutdowns in the U.S., the latest data from the U.S. Department of Labor shows at least 26 million people have now filed for unemployment. That's more jobless claims in 5 weeks than all jobs created since the Great Recession.
It's staggering and it's depressing, and it makes me worried for how long it's going to take us to crawl out of this when this is over.
For weeks now, John Hyman, an attorney in Ohio who deals with unemployment claims, he has been helping businesses and their employees navigate the unemployment system. In the first few weeks, he dealt mostly with issues around people being unable to get through to unemployment because the system was so overwhelmed.
The access issue has gotten marginally better. I still don't think it's great.
But the bigger issue Hyman is dealing with now is people who get through and are able to file a claim, they're reporting not getting the money.
Only 35% of claims are being paid out. So 65% of people that have filed claims have still not seen $1 in the door for unemployment.
Those are the numbers in Ohio, and they're actually better than some other states, like Florida, for example, where only 14% of claims have been paid out and 86% of people are still waiting for unemployment help. Some have been waiting for a month.
And when you look at a state like Florida, which that was in denial this was even a problem until a couple of weeks ago, it's not surprising that a state like that was so slow to react to the crisis in general, is having such a problem getting claims paid to their employees.
Florida's Department of Economic Opportunity is now saying that it has been able to conduct necessary performance enhancements, which should speed things up moving forward. If there's any other silver lining here, it may be that most states are saying that once they're able to get unemployment claims paid, they'll go and backdate some or all of those claims. I'm Alicia Nieves reporting.
Alicia, thank you. Now, doctors say coronavirus seems to be causing strokes in younger people who aren't that sick. Mount Sinai doctors say they have seen 7 times as many sudden strokes in young people in the last few weeks than usual. Most of those people had no bad medical history. Many of the patients, according to the doctors, had mild or no symptoms of coronavirus. Gas prices are quickly dropping, with some places seeing prices as low as $1 a gallon. Barrel prices went negative this week for the first time ever. Now some are wondering what this means for drivers and workers in the oil industry. Oil producers are now paying stockpilers to take barrels off their hands. Now that doesn't translate to getting paid to take gas at the pump. In fact, gas probably won't get down past 50 cents a gallon. Industry experts explain oil producers still need to make some profit.
You know, there's a cost of taking a barrel of crude oil and converting it into gasoline. And so we would generally expect that cost is going to set, some sort of a baseline for it.
Low gas prices, well, it's not good news for everyone. People in the oil industry are directly impacted when barrel prices go down.
So when we see the prices dropping like they are right now, we have firms that are looking to plug a lot of these wells. And as they plug them, it takes a little bit of work to do that. But once that's done, on down the road, these folks are not going to be working that well.
A big problem is we can't take advantage of these oil prices really if we wanted to, right? Because people aren't really traveling or making money. And once demand picks up again, so will prices go up. Experts say this could be anywhere between 6 months to a year from now. People and organizations are doing what they can to get on track towards some normalcy. Our partners at Newsy has a path forward for some restaurant workers.
Yamisha Gilbert. I'm the general manager of Succotash Penn Quarter. There's no more dine-in, so everybody's doing takeout that can, and a lot of places have chosen to close their doors because they just can't sustain that way. It's just a couple of managers and a couple of chefs working each day. We don't have servers, we don't have the bussers, we don't have our bartenders. So all of those people, unfortunately, right now are unable to work. We call Succotash Penn Quarter. We have two things going on. Succotash Penn Quarter is open for takeout. However, our company is also part of the Lee Initiative, and with the Restaurant Workers Relief Program, the program that we're hosting, we offer a hot meal every day as well as supplies, and all of this is mostly donation driven. This is specifically given out to people in the hospitality industry in our area that have lost their jobs and have been affected by the coronavirus. We put together packages for people every day. You can come 7 days a week, and we're here. We're here to help. I think the path forward is, just giving to our communities, making sure we stay community connected, make sure that, if anything, this shows how much we depend on each other, if nothing else. Never lose that attitude of gratitude, because I think that that's really where all this comes from. We're in the service industry because we have a passion for service. We have a passion for helping people. And this is just a different way to do that. And you have to be just as passionate about that. And so just making sure you have genuine compassion. I've made so many new friends just by working the Lee Initiative, people that come every day and, just a little bit of small talk to help break up their day. People are stuck inside. I've heard so many times that just they'll walk up here to grab a meal that they know is going to be delicious and they get some supplies that they need to feed their family, then that's the highlight of their day.
Coronavirus is uniquely impacting communities dealing with poverty. How experts say access to health care is having a domino effect. And why doctors think some coronavirus patients' feet are turning purple. Next.
Sticking together while staying apart.
The virus has revealed holes in our nation's healthcare system, especially in communities dealing with poverty. Chris Conti is exploring some of the needed changes.
So it's really diverse.
In cities across the country, there are neighborhoods and zip codes where the virus is hitting hardest. Communities which were struggling long before the emergence of COVID-19.
Well, I think it's created a lot of concern and uncertainty.
Mary Cole lives in one of those places. She's currently sheltering in place inside her home in East Boston, a section of Boston where healthcare and cheap housing are notoriously hard to come by.
We're a working class neighborhood. And a lot of the people in East Boston don't have the luxury of doing what I'm doing, which is to shelter in place.
This working class neighborhood is a myriad of minorities and immigrants. They have been hit harder by coronavirus than most other areas of the city. Why? Many people didn't have good health care here to begin with.
If you don't have a healthcare home, then you don't feel comfortable just walking in and getting the treatment that you need.
That is Manny Lopes. He oversees the East Boston Neighborhood Health Center, a local nonprofit. Many of their patients who might have COVID-19 are too scared to come in for fear their immigration status will be checked, or they'll end up with a hospital bill they can't afford.
A virus like this, and then added with unemployment, unstable housing, just really magnifies it 1,000 times.
And a lack of affordable housing in major cities across the country is only adding to how fast the virus is spreading. When a family of 6 or 10 is crammed into a 600 square foot apartment, there's no place to self-quarantine if someone gets sick. To keep up with the problem, places like East Boston Health are outreaching to patients in multiple languages about COVID. And even if someone tests positive, the hope is that now they'll be more likely to get preventative care in the future.
I worry about people who have to go to work every day.
As the country rebounds from the virus, there's no shortage of issues coming to light. In Boston, I'm Chris Conti reporting.
Chris, thank you. Medical professionals are now documenting skin conditions among coronavirus patients. About half of them have what's been dubbed COVID toes, purple, inflamed feet that looks like frostbite.
We have had some very sick patients who have developed this, but they tended to develop this at the same time as those other symptoms. So I don't want people to panic that if they see these toes, that it means that something really bad is coming.
Dr. Esther Freeman says the reaction could have other triggers, ranging from something simple like cold weather to serious conditions like lupus. Some patients have shown no other symptoms and tested positive for COVID-19.
And that, to me, I think is particularly concerning just because that's the group of patients that might not realize that they're putting other family members at risk.
Dr. Freeman says coronavirus patients typically see 3 skin conditions: a measles like rash, hives, and net-like pattern on the legs. Those are also common among other viruses. However, the purple toes appear unique to COVID-19. Doctors say this has been mainly in young adults and kids and say there is no proof tying the virus to COVID toes. Researchers are finding some common but unexpected symptoms among coronavirus patients. David Biskobing spoke to a doctor who's taking part in a global study.
COVID-19 is an upper respiratory infection, so most people, even doctors, expect fevers, coughs, trouble breathing. But neurologist Dr. David Wang says there are many who have symptoms that are different.
So almost 2 to 3 out of 10 patients with truly COVID-19 infections may have these symptoms without the so-called typical respiratory complaints.
Dr. Wang is with the Barrow Neurological Institute in Phoenix. As the outbreak began, he partnered with the team of doctors in Wuhan, China, the epicenter of the disease.
They tracked 214 patients who had confirmed the diagnosis of COVID-19, and then they had some interesting findings.
Those findings just published in the Journal of the American Medical Association. They show 36% of COVID-19 positive patients had neurological symptoms, from dizziness, headache, to loss of taste, smell, and or vision, and even stroke.
Initially, people always felt that neurological manifestations should not be common.
The team published its findings so that doctors and nurses don't overlook neurological symptoms as an unexpected but common clue for COVID-19. Quote, during the epidemic period, clinicians should consider neurologic manifestations to avoid delayed diagnosis or misdiagnosis and prevention of transmission. And as for the long-term effects, Dr. Wang says that's largely unknown.
The ones that are early on, such as loss of smell or taste or body aches, will disappear when you recover. Stroke, hard to tell. The other clotting issues, it depends on how extensive that is.
Now, if you've been having trouble sleeping, you're not the only one. Experts say sleep is one of the first things impacted by stress. Now, here are a few things to help get back towards a regular sleep schedule. You want to keep that regular routine, eat well, be active. Also watch the caffeine intake, and don't be afraid to talk to someone. Tens of thousands of people who work in the restaurant industry have been hit hard by coronavirus. Kai Beach shows us how a restaurant group is supporting workers across the country.
I think everyone was in shock at first.
Restaurants across the country are dealing with the highs and lows of the coronavirus pandemic.
It's just been a lot of roller coaster of emotions.
At Postino Lohi, they had to lay off most of their staff after state orders forced this dine-in restaurant to go takeout only. And the workers that are left, like Corinne Trujillo,
Your order was packaged with care?
are looking to preserve their business and also figure out ways to support their team.
Basically, in lieu of gratuity, we are reallocating some of those funds to our team members who are unable to work right now.
The movement is called Takeout for Teams. The goal is raising $500,000 in donations for workers that lost their jobs.
And what was really interesting about this that happened to our industry was we literally went dark overnight.
Lauren Daly's the CEO of Upward Projects, a restaurant group with locations in Arizona, Colorado, and Texas. She says COVID-19 restrictions forced her team to furlough about 80% of its staff, which is about 1,200 employees.
It was devastating to us to take what we consider our family and have them lose their jobs overnight.
Upward Projects teamed up with Fox Restaurant Concepts to start this program where customers can donate to the entire restaurant group instead of a single server.
As terrible as this has been, it's been so beautiful to see this incredible human kindness come from so many people.
People like this man.
It's always good to help other humans if you can.
Who donated a couple dollars while picking up an order of meatballs, cauliflower, and a few bruschetta boards.
You know, all these businesses are struggling, so I think anything you can do to get out there and support them, we should.
I mean, I think it's amazing that the company's still looking out for everybody and doing what they can. Yeah, go ahead.
During this time of uncertainty, Trujillo says even a small donation can make a big difference.
90% of the time, people are so excited about that, and they want to make sure they can contribute.
Contribute to a cause that's helping people across the country. I'm Kai Beach reporting.
Kai, thank you. Now, a simple gesture is going viral in a D.C. neighborhood. We will take you through the street safari, bringing a community together.
6 working together, working for you.
Welcome back. A community is using adventure to keep kids entertained. Maya Rodriguez shows us the street safari that is really taken off.
Listen closely. What's that? They're the sounds of a safari, unlike any seen on these streets before.
And we thought it was going to be 20 animals, and we are now over 270.
270 stuffed animals of all kinds roaming at the windows of the Georgetown Street Safari in Washington, D.C. There are bears and bunnies and cows and fish and this, giving kids like Katie something to look forward to on a walk.
And do we see little animals in the windows? Like, I think we saw a lot of bunnies yesterday.
Judith Bonnell and her daughter, India Olszewski.
Our only goal is to bring a bit of joy.
Are the guides behind the safari, complete with an online tracking map posted on Facebook.
And I said, India, wouldn't it be fun? Do you think you could make a treasure map for kids looking for stuffed animals in Georgetown?
And then it took on a life of its own. Hundreds of area homeowners jumped in to let them know about their little animal in the window.
And we see these little kids with the map in hand, walking house to house and pointing.
And the kids?
It has been a nice neighborhood activity, and I think, especially with the young kids, the ability to get outside and walk around. And Katie gets super excited when she looks up into the windows.
Seeing your friend's house, maybe you can't go play with your friend, but at least you can see their house and see their animal and have some sort of shared experience.
With a chance to rebuild connections and your imagination. In Washington, D.C., I'm Maya Rodriguez reporting.
Great stuff, Maya. Thank you. Now, high school seniors aren't experiencing a traditional send-off this spring. The unique tribute in the works in one Maryland town. Next.
Better pizza, better than a sandwich. Papa John's.
Welcome back. Each day we end the rundown with the stories that remind you of the good that is going on right now. And today, it's the Maryland community paying a unique tribute to their local high school seniors who aren't getting a traditional send-off. A photographer had the idea to put the seniors' names and faces on banners and hang them around town and have it to Grace, Maryland. Now, she teamed up with a local sign printer and the mayor to make all of it happen, creating a plan and raising thousands of dollars. It's a gesture that she knows will mean a lot to the community and, of course, those students.
Imagine walking on the streets and see those faces, and I'd be crying. I'm telling you right now, I'd be crying.
We're very, very grateful that everyone is working so hard to make us feel so special.
Now, another reason that this class is special to this community, they are the last group of seniors to graduate before a brand new high school opens in town in the fall. And that's all the time we have today for Coronavirus The Rundown. We'll see you next time. I'm Chris Stewart. Thanks for joining us.